Hi, my name's Rachelle, and I'm with the AIHM Student Alliance, and I'm the Executive Chair for the Leadership Council. I'm here with Dr. Mark Hyman,
Hello.
who is actually going to be one of the keynote speakers today for the AIHM conference. And I just wanted to introduce Dr. Hyman and also just to get some, just what are you excited about the conference? What can we look forward to during your talk?
Well, I'm super excited to be here. I love Mimi Guaneri. She's an old friend who's really a pioneer in thinking about how do we change healthcare, transform the way we think about health, and really is inclusive of so many different aspects of our healing that really brings us into a new way of thinking about how we create health in America and even globally. So I'm super excited to be here. I love the movement she's created. I love what she stands for, and I know who's here to support me and the big cat. So, and my talk is about fat and, trying to change people's minds around the way we thought about fat, which is that fat makes you fat because it has more calories than carbs and protein, and the fat causes heart disease because you get fatty streaks in your arteries, and that's caused by cholesterol and fat, and if you stop eating fat, that'll get better. And the science has really shifted. We had some initial data that showed, observational data that showed that eating fat may be correlated, but not necessarily causal to heart disease and obesity. But now we look at the data in a very new way, looking at the drivers, which is really our high carbohydrate and high sugar and starch diet, which is driving metabolic syndrome, insulin resistance, which is really the main driver of heart disease. And what people don't understand is that your cholesterol actually gets worse. The overall profile gets worse when you eat starch and sugar, and gets better when you eat fat in terms of your triglycerides, your HDL, and your overall profile. And in terms of weight, when you eat fat, it actually does not increase insulin, and insulin is the main driver of weight gain and of visceral fat, which is what drives most heart disease and most diabetes, Alzheimer's, cancer. And this visceral fat is the dangerous, angry fat that is causing so much of our chronic disease burden. And that's all driven through eating starch and sugar, which causes insulin spikes, which then causes fat storage. When you eat fat, the opposite happens. You stimulate your metabolism to speed up, you actually liberate fat from the fat cells, and you actually decrease your hunger so that you end up having a faster metabolism and less hunger and more lipolysis or release of fat from the fat cells. So this is really the paradigm shift, and it's very hard for people to switch because they understand that they have this sort of mindset of this low-fat era, but people no longer have to be afraid of avocados and eggs.
I absolutely agree, and these are topics I know you have highlighted in your book, Eat Fat, Get Thin.
Yes.
And as a student, it's been pretty helpful. I'm studying Chinese medicine, acupuncture right now. Nutrition is such a big part of this medicine.
Right.
Can you just talk a little bit on how students can, at this level, medical students of any discipline, can benefit from reading your book and benefit just from the topics that you highlight?
Sure. I mean, I think that Chinese medicine is really awesome because it's drives home the understanding that food is medicine. In fact, the word in Chinese for take your medicine is 吃药, which means eat medicine. So we have to think about eating our medicine, which is really not which is not a real familiar concept in healthcare. Most doctors don't think about food as a drug. In fact, it's a more powerful drug than any drug that's out there. So when we look at nutrition, this is why I write about how food is medicine and write books about insulin resistance and about fat, and even working on a book about protein to understand how do we use food and all the components of food that are far beyond the macronutrients to regulate our biology and regulate how we heal. And so I think that's really where a lot of traditional healing systems are far ahead of Western medicine, which is thinking about how you can use food as a drug.
Thank you so much, Dr. Hyman.
You're welcome.
Really look forward to your talk, and everyone join us at AIHM 2016.
Thank you.